Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power. Hi, I'm Dr. Warren. Today I'm going to run through some questions about long-term effects about Lyme disease that I've gotten frequently in the clinic. Because when people have Lyme, there's a lot of timing questions I get. There's also kind of this, oh no, if I don't catch it in time, am I doomed? Will I have this forever? And so we'll try to run through some of those questions, and I'll try to give some clarity on some of the phases and the timing and things you can do at any stage to get better, heal, and be healthy again. So to start off, let's talk about the chronic effects of Lyme. So when you first get Lyme, it looks often like a summer flu, and you can get a localized rash that can look like a bullseye. If that is how Lyme looks, if you get kind of a flu type thing in the summer and we get a rash with it and we know we've been exposed, we've been in outdoor areas, in grasses, in forests, anywhere where there might be deer ticks, then certainly that can be the way Lyme looks. If Lyme looks that way, that's the way we find it most commonly and the best. Lyme can also look very different. For some people, it goes systemic, and it can do this as early as about a month or two. But some people, it hits the nervous system very hard. So we get weird neurological symptoms. This can be anywhere from Bell's palsy to burning, tingling, to any kind of other cranial nerve problem from the trigeminal nerve, vestibular problems if it hits the vestibular nerve. And so depending on which nerve it hits, it can give you a different symptom. Now this is more common to develop 2 to 12 months after the bite, but some people can get these nerve involvements very quickly. It's more common that it comes out acutely as kind of a flu type illness, and then the nerve symptoms come out a little bit later. The other thing that can happen is Lyme in the chronic phase can look like a chronic pain neurological disorder. So we get that flu-like illness, and then we just get, that you may even not remember, that flu-like illness you may even might not have been a huge deal to you. And then later it looks like we're developing some kind of rheumatoid arthritis or lupus or some kind of inflammatory arthritis that our body is going through. These are the two most common long-term presentations that can develop months to possibly years after the exposure in certain individuals. Now, because Lyme disease, the antibiotic protocol for Lyme disease is much more effective if we get treatment in the first 30 days, it's important during spring, summer, fall months, any time where the temperature is above about 28 degrees, the ticks can be active. And so if you know you're exposed, the antibiotics can work well if you catch it right away. Once we're past that window, they're less effective. And so we get into more of the chronic type treatments once you get past 1 to 2 months, and definitely by 3 to 6 months you're into the more chronic and more elusive phases of the disease. I often get the question of how long do these Lyme disease symptoms last? And because in a certain percentage of people Lyme goes chronic, they can last in perpetuity. So once it goes chronic, you usually have this initial phase of symptoms where it's like a flu, sometimes can be headaches, sometimes can be fevers. That typically goes away anywhere in the first 1, maybe 2 months. And then it transforms into something that's a little bit different. It can cause some heart-related symptoms where people go to the ER because it's scary. But the most common presentations are you get these chronic inflammatory joint, muscle, headache, neck ache problems, or we get the neurological complications where your nervous system's really behaving abnormally. And this is often coupled with some kind of fatigue. The doctor term is called post-exertional malaise, and I call it push-crash fatigue. You push to do something, and then you kind of crash and have to recover. Push to do something, crash and have to recover. But once it's entered the chronic phase, these things can go on in perpetuity for decades in some people. And there does tend to be kind of an up and down nature, so it's not like it's steady. You still have some days that are good, some days that are bad, so there's some variance, but they can just go on practically forever. So another question I get is, what factors influence how long the symptoms last? Well, one of the key things that when we're looking at a patient's history is how many cofactors do they have. So remember, Lyme, when it's chronic, most of the time is not alone. There's about 93% of people we see who have a co-infection with it. And these co-infections, when they combine with Lyme, become much more powerful. So Lyme plus Babesia, or Lyme plus Bartonella, or Lyme plus Anaplasma, or Lyme plus Powassan virus. These are different conditions that all kind of get lumped in the same box. But the thing that happens is they all are trying to evade your immune system in slightly different ways. And they're able to successfully do that and cause chronic illness a certain percent of the time. We're all arguing about if that fail rate on Lyme is 5% or 10% or 20% or 30% right now. But we've established there's a certain fail rate, and we're doing more research to try to figure out exactly how many people are falling through this Lyme disease crack in the system. But if we throw other health challenges on top of you, so abnormal chemical exposures, abnormal stresses or chronic stresses, poor nutrition, poor sleep habits, it certainly can make getting you better from Lyme more complicated the more extra things that I tack on to your system. What are the long-term effects of Lyme disease? We've talked about this. Most people, it comes across in the joints, pain, or it comes across in the nervous system. Some people it comes across in the heart, and so we feel some of these abnormal heart symptoms. What I want to stress is that when this is hurting part of your body, we want to be able to get rid of the bugs, help your immune system calm down, and then repair the parts of your body that kind of took the brunt of the damage so that you can live your healthiest life. I do get questions that kind of go on this, am I doomed? Am my body's just wrecked and I'll never be healthy again, Dr. Warren? And I really want to encourage you, if you're feeling this way. I've seen people who have had this for months, and I've seen people who've had this for decades heal and recover and live very healthy, robust lives where you can do all the things you dreamt of doing. I joke with my patients. I say, if you're 60 years old, I say, I can't make you 20 again, but we can make you healthy from this point on. And I think this is very important because I've seen people of all ages, from very young through the teens and 20s that are disabled and sick from Lyme, all the way through into 70s and 80s. I have not had a patient yet who's older than 90. We've had several in the 80s, some who are living, once again, very healthy, robust lives. So it kind of stretches the gamut. Why do symptoms go chronic for some people and other people just get better from Lyme disease? This is a terrific question because right now we've established that chronic Lyme is happening. That happened between 2022 and 2023. The CDC acknowledged that chronic Lyme was a real thing, whereas in 2022 it was pseudoscience and pseudomedicine. And then in 2023 there was an acknowledgement that it was real. That's super recent, and it's the hard work of so many advocacy groups helping get research and data on this disease that we now know it's officially happening and it's real. Now, one of the big arguments is, what's the failure rate? So there's estimates anywhere between about 5 and 30% of people who get Lyme are having chronic long-term symptoms and are not recovering and returning back to their previous level of health. So we know that there's a certain percent, but we don't know exactly what that percent is. We're still gathering data on that. I don't think this is too surprising if you look at medical history. If we look at other diseases, there's a typical way it goes, and there's often a subset of people who have a much harder time with the disease. I'll use COVID as an example because it's so recent, it's fresh in most people's brain. So when we look at COVID, it had a 5% hospitalization rate and a 1% death rate, which means 90+% of people got it and got over it relatively smoothly. We could maybe go to 90% people got over it smoothly, and 10% time had a harder time. But there's many diseases that most of the population handles, and then a small subset of the population has a really hard time with. If we look at polio, this is a very similar thing. We have most people get it and get over it, and a small subset, 1, maybe 2% of people become paralyzed, the way we think President FDR, the famous person with polio. But that did not happen 100% of the time. In fact, it didn't happen very often. But if it happens 1 or 2% of the time and everyone in America has the disease, that's still millions of people who are paralyzed from something like polio. So there's many, many diseases in history where we go, oh, even if you look at the bubonic plague in history, it didn't have a 100% death rate. It had a 25, maybe a 35% death rate. And so still 75, 65% of people getting the Black Plague survived through it, which is an amazingly high death number. But still, you have a lot of people getting it and they survive through it. So it's not a new phenomenon that you're going to have people who get Lyme, who a small subset of them, somewhere between 5 and 30%, go chronic and don't return to health. And a large portion of people just get it, it's a flu, their body beats it, and they move on. So we know this is happening. It's not as unusual as we might think if you look through medical history. And Lyme disease is just another one of these bugs that has a subset of people who are not beating it and getting better. And that's where you end up with chronic Lyme, or what we're now calling post-treatment Lyme disease syndrome. How bad can Lyme disease get? This is a good question because I get misnomers about how severe Lyme disease is. So about 20 to 25% of the people who I help in my clinic are so sick they are disabled. They cannot support themselves, they cannot go to school, they cannot work, and they are dependent on other people to support them. And 75%, maybe 80% of my clinic is people who they're still pushing through life the best they can. It affects them, it affects their ability to do quality work. They don't have the energy to do social things or to be a husband or to be a wife or to take care of their family the way they want. But they are still kind of pushing through life absolutely the best they can. There are people who are so sick they're disabled, but still the vast majority of people I see are just trying their best to do what they can to make life work. So you don't have to be totally disabled. I think sometimes on the internet people think all the people with Lyme disease are totally disabled. It is amazing what people push through for their family, for their spouses, for those that they love, and they just try to make the best of life. It's very inspiring for me to see what people do in the face of some of these health challenges. But there's definitely a subset of people who it's so bad they cannot. But the key for us is we want you to be healthy again, so you can live life. I mean, that's the funnest part of my job, is when people come back, and I just had one this morning where, you know, she's doing things for her family she couldn't a year ago. She's helping her daughters do this thing. She couldn't do those things a year ago. Her marriage is completely different. She couldn't do that a year ago. She's picked up a part-time job. She couldn't do that a year ago. So it's really fun as people heal and then they kind of re-engage in life, whether that's volunteer work, professional work, family life. It is fun to see people get better and go live their life. That's the most rewarding part of the job to look at. Another question I get is, do you ever fully recover from Lyme disease? And I want to answer this question extremely firmly. Yes, you can recover from Lyme disease. You know, hidden in this question is the, am I doomed? Will I ever get better? And I cannot communicate more clearly. This is one reason I got this question so often from, I think, just sick people who felt so hopeless. This is why we started saying, I've got to start recording testimonials, which you'll see, you know, posted at different spots on our website and shared on our YouTube channel, because I need sick people to see people who have gotten better. I had an employee who worked for me for a year or two, and at the exit interview I said, what was your favorite part about working here? And she said, honestly, before I worked here, I didn't know people got better from Lyme. I just only encountered people who hadn't really recovered. You know, I see people get better frequently, and I've been seeing it for years now, so it was something that I was just maybe a little numb to. And that's the big reason why we made the change to start doing some testimonials, so, you know, we could show sick people there is hope. You can be healthy again. When is it too late to respond to a tick bite? This is a question I get frequently, and on one hand, I'll tell you, in the acute phase, the antibiotics work best by 30 days, and it's becoming very resistant by 60 days. So that's some of the studies we know. As Tulane did a study where they took mice, gave them Lyme, and by 60 days, it's becoming much more resistant. You have to hit it much harder than the standard protocol to get results by 60 days. Now that's the acute to chronic, how fast that changes question. Now on the other hand, there is no too late. If you've had this for 6 months, 6 years, or 6 decades, I have still seen people heal and recover and go on to live very healthy lives. So in the acute phase where the simple antibiotic protocols work, 30 days is best. By 60, you're probably missing out that window. But then on the chronic long term, it doesn't matter how long you've had it. The body has incredible healing properties. It's never too late to work on getting healthier and having a better life. And that answer, it's never too late. I've seen people have it for decades and still make incredible progress and live happier, healthier lives. All right, as it's Lyme Awareness Month coming up, I'm recording this in April, and May is always Lyme Awareness Month. So what do you do if you get a bite? If you get a bite, we recommend talking to your doctor because the antibiotics tend to work the best if you get them right away. We talked about that numerous times. Also, in our office, we recommend our acute bundle, which is basically garlic, neem, and a probiotic. We find that has the immune nutritional support to really help if you get a myriad of things in the tick, because in the acute setting, I don't have time to run a really thorough test and see exactly what you have. So those two antimicrobials, garlic and neem, have a really good coverage for like 10 different tick-borne illnesses that can come through. I prefer you to do the standard protocol that your doctor is supposed to do with you, and we do garlic, neem, and a probiotic right alongside it for about a month if you know you've got a tick bite. All right, in closing, I'm just going to remind you that healing is not a one-size-fits-all approach. At our office, if you are struggling with this, we really think looking at your history, your symptoms, but running very thorough tick-borne testing is a huge piece to the puzzle. We believe in the body's ability to heal, and I've just seen it work so well over time. But if you are struggling with your health, wanting some help, please reach out to our clinic. We have that free phone call. We can talk with a team member and hopefully get on the road towards a healthier you and a healthier life. Thank you so much.